Good day. So today I would like to present my video presentation about my thesis proposal for N299 as my final exam. The title of my study is about compliance of professional healthcare workers to hand washing. Introduction. Hospital-acquired infections significantly cause an alarming situation in healthcare setting. In fact, in 2016, 63 patients, or about 28% among 224 patients in a tertiary hospital in the Philippines have acquired pneumonia during their hospitalization. In American Hospital alone, the Center for Disease Control estimated 1.7 million and 99,000 death-related cases due to healthcare-acquired infection, including pneumonia, urinary tract infection, and bloodstream-related infection. Hand-mediated transmission is considered as the main contributing factor in the spread of hospital-acquired infection. The significant role of hand washing was evident even during the 19th century. The Center for Disease Control published guidelines in 1975 and even in 1985, which advocates the use of antimicrobial soaps during pre- and post-procedure. Alcohol-based solution is acceptable in a situation wherein zinc is unavailable. In 2002, guidelines for hand hygiene has been revised, suggesting the use of alcohol antiseptic before and after handling patient. According to CDC, hand hygiene compliance rate ranges between 5% to 89%, which is validated by World Health Organization as very low due to several factors, such as poor nurse-patient ratio, time constraints, and even negligence. The occurrences of post-operative infection in neurosurgical cases, including benign and malignant cases, ranges from 2% to 5%, while glioblastoma was about 5%. Malignant brain tumors are at higher risk due to several factors, including advanced age, poor sanitary condition on the head region, nutritional deficiency, or even low performance status. About the objectives of the study aims to determine hand washing compliance among healthcare workers, including physicians and nurses, in an event when post-operative infection neurosurgical cases is evidently increasing, specifically in a teaching hospital in the Philippines. Specifically, the research will answer the following research question. Number 1, what is the level of compliance among healthcare workers, including physicians and nurses? Number 2, what is the prevalence rate of infection among neurosurgical patients? Number 3, is there a significant relation between compliance to hand washing and prevalence of infection in neurosurgical infection cases in a university hospital in the Philippines? Number 4, is there a significant difference between compliance to hand washing among physicians and nurses? Moreover, significance of the study will tackle about compliance in hand washing among healthcare workers during routine patient care. Identification of opportunities during indication exists as identified by World Health Organization's 5 moments of hand hygiene. Furthermore, findings of the study will significantly contribute to the following. For the healthcare providers, the findings of the study will reduce the risk of spreading infection-related diseases within the healthcare setting. For the patients, the imposed risk of prolonged hospitalization will diminish, as well as the attainment of overall wellness may be achieved. Moreover, in the hospital administration, the study may further create a standardized procedure to fully implement hand washing measures to specifically target post-operative infection. And finally, in nursing research and education, findings of the study may implement strict compliance in hand washing practices, which can be enforced in academe up to actual hospital setting. The scope and limitation of the study. The scope of the study is limited in neurosurgical cases which had occurrences of surgical site infection in relation to compliance in hand washing practices. It is conducted in a teaching hospital, a tertiary level, wherein surgical site infection is prevalent. There is also several post-surgical procedures, but only neurosurgical cases were involved in the study. Other healthcare workers other than physicians and nurses were not included in the study. About the review of related literature. Introduction. Hospital-acquired infection caused an alarming situation among healthcare workers, most especially patients, because the magnitude of the problem in terms of associated mortality, morbidity, and even cost of treatment. Historical background. In the early 19th century, significance of hand washing has been conceptualized by Labarake. He provided the first evidence of how decontamination reduced the risk of mortality and even puerperal fever in a maternity ward. In 1840, Semmelweis worked in a great hospital in Vienna, and he concluded that some cadaverous material caused puerperal fever, and he instituted a policy of washing hands with a chlorinated lime after leaving autopsy room in a maternity ward. In 1950, Mortimer et al. Showed that the direct contact was the mode of transmission of Staphylococcus in nurseries, which also demonstrated that hand washing per se reduced the risk of the incident. In 1975 and 1985, CDC created a guidelines on hand washing practices. Hospital setting primarily advocates the use of antimicrobial soaps and alcohol-based product in unavailability of the same. In 1995, Hospital Infection Control Practices Advisory Committee advocated the use of antiseptic agents upon leaving the room of uninfected patients with multi-drug resistant pathogen. In 2002, CDC proposed new guidelines in hand hygiene, which recommends the use of alcohol-based hand rubs in the contamination between each patient's contact, and the use of soap and water on visibly soiled and contaminated hands. In 2005, World Health Organization launched a global campaign named Clean Care is Safer Care as part of the World Alliance on Patient Safety. In 2009, World Health Organization about the conceptual framework. I chose health belief model. It was developed in 1950s, exploring the reason why people fail to adopt preventive measures. The model remains the most widely used applied theories in evolution and implementation of health behavior intervention. Health belief model has been applied in clinical setting to examine preventive measures. The theory can be conceptualized that the perceived susceptibility to infection by healthcare workers' consideration of healthcare benefits predominates the barriers as perceived and other external factors, considering cues to action such as hand hygiene practices. Moreover, methodology. The research design. I chose a qualitative study based on planned behavior theory. So it is used as my framework in elaborating incidents of compliance in hand washing, consisting group discussion and interviews. Regarding sampling design, a purposive sampling was used in the study to ensure equal representativeness of the respondents. They will be selected based on predetermined groupings. The sample size. The population size is 46. The response distribution is 50%, and the recommended sample size in a given population is 42. Regarding data gathering procedure, data was collected from a total of 14 physicians who are all training as resident physicians and 32 permanent staff nurses from respective areas within the neurosurgical exposure. A total of 46 healthcare workers who are presently assigned in a university hospital. In this study, there is a random pick of healthcare workers regardless of the availability of their respective professionals. A semi-structured interview guide was consistent with the theory of blind behavior as a light of the literature. Analysis of the survey data. All interviews were transcribed verbatim. Data were evaluated through thematic content analysis. Key concepts were developed through coding frame. The initial coding frame was revised through several reading of transcripts, and lastly, interviews were reread and coded with the final team. About the ethical consideration. The study was subject to approval by UP Manila Research Ethics Boards and was assigned to Protocol Code UPM Rev 2019 dash. I don't have the given number yet because I was about to send it for validation. Once it was validated, I think it would be good for 1 year. All participants were included in the study after being informed and taking their signed consents. All data were analyzed and presented anonymously. Participants in the study is voluntary. A number of code is used to individual questionnaire to maintain anonymity. Instruction sheet was included in each questionnaire in a brown envelope. So to finish my presentation, I would like to include my daughter in sharing a quote about research. So you have to read it. Research is creating new knowledge by Neil Armstrong. Thank you. Bye.